people want the holy grail, right? They want the injectable lunchtime treatment, and they're looking to have a permanent result from it. So people are willing to buy into this stuff, and that's where the consumer really needs to be aware.
This is MedSpa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Hi, this is Dr. Kate D, and I am speaking today with Dr. Cory Goldberg. He is a plastic surgeon in Canada. He grew up in or around Toronto, got his MD degree at Queen's University in Canada, and did a plastic surgery residency at the University of Toronto, followed by a subspecialty fellowship in craniofacial plastic surgery at the University of Southern California in Los Angeles. And he's a diplomat of the American Board of Plastic Surgeons and also a fellow of the American College of Surgeons. So, Cory, thank you so much for being on the podcast today.
It's my pleasure, Kate. Thank you so much for having me. I'm looking forward to the conversation.
Yeah. So, what I'm hoping to cover today, at least in the first half, are just the various complications that you've seen and had to take care of that are the result of MedSpa procedures. And then hopefully we'll have time to talk about our concept of what is natural beauty and what we're actually trying to achieve in the aesthetic space.
For
Sounds
sure.
good?
That sounds great.
Okay, awesome. So I know that you've been called to deal with various complications in the ER. So have you ever seen complications with either Botox or fillers, or can you talk about that?
Yeah, absolutely. Well, let's start with Botox. That's
Okay.
pretty obviously a very common treatment. So one of the cases I was called for, and just to clarify, I mean, my practice is at this point strictly cosmetic, but up until a couple of years ago, it was half. So I had a full cosmetic practice, but then I was also hospital based and doing on call and trauma call and that kind of stuff. So I mean, it really allowed me to see a wide variety of things from med spas and cosmetic complications from other places. So over the years, I definitely saw quite a range of that.
I think actually it's helpful for our audience just to know that because a lot of people think of plastic surgery as purely cosmetic. So there's really the half you're talking about is the other half is reconstructive surgery, right? So when somebody's
Yeah.
been injured, restoring what they used to look like if they had injury, their ear got ripped off or something, right? You can reconstruct an ear. Can you do that?
Yeah, actually, part of my fellowship actually was ear reconstruction, although more for congenital things. But yeah, that was part of it. And I mean, I would see infections, soft tissue infections like flesh-eating disease, necrotizing fasciitis that comes to plastics, and of course, breast reconstruction and post-cancer types of care and skin cancer. So the reconstructive side of plastic surgery is actually very broad, and it's a very big world. And for me, it was a really nice balance to have both my reconstruction. I did a lot of facial trauma as well as my cosmetic facial stuff. So there
Mhm.
was a balance there. And actually, it was a very helpful skill to have the cosmetic part of things, because when I saw these kinds of complications of things come through the emergency room, it wasn't out of left field for me. I was ready for it because I knew what these treatments were. So I was very glad to have that kind of mixed practice.
Yeah, it was actually one of my favorite things in medical school. Not that I was going to become a surgeon ultimately, but it just was so fascinating to me to be able to recreate parts out of other parts and make them look good. It's really one of the most creative things in all of medicine. I just think it's cool. So, anyway,
Back to the question at hand.
back to the question
Uh,
at hand here. So, you've seen
so
some toxin complications.
Yeah, so the main toxin complication that comes to my mind was a very interesting case, and it didn't. First, I wasn't sure what had caused it because the patient didn't tell me. But it was a young man in his mid-30s, and he came to the emergency room with a painful lump on his forehead, and that was the presenting complaint. And he got sent to my Emerge clinic, and I saw him, And by the time he saw me 2, 3 days later, he had actually developed a whole bunch of them and had 4 or 5. And these were like red hot, painful lumps on his forehead. And I asked him the questions, and you know where this is going, right? Because we started talking, saying this is a neurotoxin issue, and he didn't tell me at first. And it was I treated him with some antibiotics, and he still didn't improve. And then I figured out that we had a neurotoxin injection done at a med spa, and don't know for sure what it was that they mixed it up with or what the issue was. But this guy ended up having at least a dozen granulomas on his forehead, and pretty much every site that he had injected turned into this painful and initially infected granuloma. And to make the diagnosis, I actually had to do a procedure. I did a local anesthetic minor. I opened one of them up in the most off to the side, like on the side of his forehead, the one that was most easily accessible because it left an external scar for him. And I biopsied it, and that it came back and it had crystals in it. And so there are not a
Crystal.
lot of crystals, right? So, I mean, you and I both know you don't get fluid with crystals in it unless it's coming from a joint that has some kind of crystal arthropathy. And so I asked him, I said, well, what did you have injected in your forehead? And he said, oh, well, I hadn't thought about it, but I'm like, okay, well, thanks for telling me. So anyway, because of the widespread nature of these things, I ended up having to take him to the operating room, and I did a full coronal incision. So that's across the
Oh
top
my
of his
God.
head, basically from ear to ear, because these things were angry and hot and they weren't resolving. So I ended up having to open them and then drain them internally. So I actually went through from the deep side
Wow.
through his frontalis
Yeah.
muscle to get to each one to drain them out so that he could have some relief and not have this ongoing issue. So that, I
And
mean, that was pretty stark. And he went on, actually, I ended up doing some jaw surgery for him and a brow lift and some other things. So he ended up becoming my cosmetic patient. But certainly that introduction, and I never found out. I have no idea what got mixed in, how they
did
reconstituted that neurotoxin.
did they ever isolate a bacterium or other
No, you know
agent?
what? No, no bacteria got isolated. It was just the crystals. And so in the end, it may just have been an inflammatory reaction to whatever the foreign body was. And it may have been initially infected and then settled with the antibiotics. But in the end, the entity, the spa that did the treatment, took no accountability for that. And even though he went back to them, they certainly didn't offer him any solutions or any explanation for what had happened. And that was it. Just left him on his own.
Wow. So, I mean, basically it was either the toxin itself that was not legit or whatever they reconstituted the toxin with. Oh my
Yep.
God. So that
Yep.
because so and we have talked on the podcast before about illegal purchasing of this stuff on the internet. You can basically buy anything. And I
Yeah.
have to say that at least in the States, I'm curious to know about Canada. I'm guessing it's the same. We do go through saline shortages here a lot. Does that happen in Canada?
Interesting. I've had shortages of lots of different things, but not
But
yet
not
saline.
saline? So, there are only 2 factories that are approved by the FDA for s to make saline, and actually, this is true for lidocaine and a few other kinds of fluids that we buy in the States, and they're both in Puerto Rico, and after the big hurricanes that were really devastating there, the factories got shut down, and ever since, there's been these waves of shortages where the factory will make, say, IV bags for a while, and over time, the little multiple use vials of saline that we use to reconstitute Botox, those, you can't get them. And I've been at one time, they were on back order for over a year. So I can imagine people like resorting to something bad.
Resorting to all sorts of things. It's interesting that you mention that because I'm familiar with the factories in Puerto Rico, and the thing that I've seen here is the local anesthetic, especially bupivacaine, but definitely
Uh,
have seen those shortages after that hurricane that really changed the industry.
yeah, and when people for us, I have a rep at 2 different medical supply companies, and we're calling around and trying we get the last case from North Carolina, and we get it we even during that year, we actually cut our dilution down in half, and we got smaller syringes so that we would be able to ration our saline because we're worried about running out of it. So, luckily, that shortage didn't last a whole year, thank God, but
Well, it's a good reminder of the interconnectedness of all things. You never
seriously.
really think that a hurricane in Puerto Rico would impact the supply chain of saline through North
Right.
America.
But hopefully, wherever you're going to get your Botox, they're legit and they're not ordering fake product off the internet because it's mind-blowing to think that they were using some non-sterile contaminated thing to inject Botox. I
Yep.
mean,
And I
I was gonna
sorry,
say
go.
when you first saw him, was it the classic distribution of injections or not
You know
really?
what? In hindsight, I recognized, but there was only 3 or 4 initially presenting granulomas, and it wasn't until it blew up, and then I'm like, "Wait a second, this is gonna group." I'm like, "Wait a second, I see that pattern." But it wasn't immediately obvious to me. So I missed it on the first visit, and then it wasn't until a week later when he really blew up, and then that made it pretty obvious. But I mean, the Aesthetic Society of Plastic Surgery just a few weeks ago issued a warning that somewhere in the south of the US, I think there was a fraudulent Botox that had been sold. There was a whole bunch of people that got sick from that, and that I mean that's just within the past couple of months. So
Yeah,
you
earlier
really do
this
have to be
year,
careful.
there were that it was fake Botox, leading to botulism. There were 22 people hospitalized. I think it was 11 different states. Only one patient ended up on a ventilator, but yeah, that kinda hit the headlines here earlier in 2024, and the only one I know for sure was there was a nurse practitioner in Illinois who was just purchasing on the internet, just didn't think about it, didn't know, I or maybe she knew, I don't know, that she was
Mm.
doing something illegal, but it was like a side gig for her. She just didn't realize she was taking such a risk. I'm like, "Uh-huh." It's really
Yeah.
terrible. In that case, though, they did publish a picture of one of the fake boxes of Botox, and it was very obviously fake if you actually used real Botox in your regular practice. If you received that box, you'd look at it and go, "That doesn't look right." But this person either didn't know that or didn't care. I'm not sure. Anyway, so do that's
Yeah.
pretty bad. Okay, so do you have other
Ye-
complications that you've seen with
Yeah,
toxin?
sure. Fillers. I saw lots of complications from fillers for sure. I mean, one of them that struck me was an infection after filler. But I mean, and of course, infection could happen to anybody, and certainly not very common with fillers, right? I mean, I haven't seen any in my own practice. It's definitely a rarity, but it happens. But the thing about this that hit me was that it was filler that had been injected on top of other filler, and it was permanent filler. It was one of those with the
Belafil?
polymethyl. It was an article or artifill, one of those
Yeah,
PMMA beads, right? And so any injector who really knows, you have to be careful about mixing any kind of products because, of course, you get into a place where companies won't look after their own issues. But this was someone had permanent filler in, and you and I both know what the risk of injecting around that is, and you're introducing contaminants around these tiny polymethyl methacrylate beads, and that's exactly what happened. So a patient had facial treatment, cheeks, nasolabial folds, and a week or two later started getting red and hot, and then started actually having drainage. And this has been done at a med spa, and the treating individual didn't take responsibility. Patient ended up in the emergency room with me, and immediately in this, like this was a sick patient. So I went into the emerge to see that patient, and I ended up having to do incision and drainage at a couple of sites, getting them on intravenous antibiotics with a home care program. And then I had them come back to see me in clinic a day or two later, and I ended up having to open more. So I think in the end I opened three spots and did drainage, and then that patient, again, once the infection resolved and they got out of the acute part of their issue, then they came back to me because they were pretty upset about having this permanent filler in it, and they asked me to surgically try and remove it, which, as you well know, I mean, it's good
it's
luck.
bad.
It's like it's impossible. But I debulked. I mean, I went into the areas where you could feel the worst of it and surgically remove, because at that point she had some scars in these places where there had been openings and drainage from the infection. So at that point, the scars were there, and she said, "Well, we might as well at least get rid of the material as much as we can." So I did that. I think I did three different procedures and debulked and took out as much as I could. And so, I mean, in the end, the tissue was softer and she felt better about things. But that patient was still left with scars, and of course, that was a completely avoidable complication.
Yeah, I mean, and so I actually write about this in the book, and I think we've talked a little bit about Belafil. So Belafil used to be called Artifil, and then that sounded too artificial, which it is. It's little plastic beads, but so they changed the name of it to Belafil. And I have to say that in the States, there are very few physicians who will inject that. There are a few, but not very many. Most of the injectors of that stuff are mid-level providers or RNs. I don't
Yeah,
personally so I mean, so the first giant problem with that stuff is that it's non-dissolvable. So God forbid you have a complication, an occlusion, you can't fix that. So I think that it just should never be used at all. I don't think it should be FDA approved. That's my opinion at all. But it is FDA approved. It's not illegal to inject it, but it carries so much higher risk. And it's also, by the way, very expensive.
Yeah.
Um,
Kate, I totally share your opinion. I completely agree. Implants are implants. I put facial
right.
implants and I put implants at various places of people's bodies, and you treat it as an implant. That's a surgical
Right.
procedure. It has surgical risks, and that's functionally what this stuff is. I mean, you're injecting permanent beads into somebody. It's a device. It's an implant, and people treat it as if it's just a filler, which it's not. I mean, it has a whole different set of complications. And those beads, I mean, those form scar. There's granulation that forms around each one, and that's how it has that
Mhm.
permanent kind of effect. But as you well know, external scars, of course, have a very broad range of how they heal. You know, some people form little scars, some people form thick. You never know how much of that scar is going to form. So if you're depending on scar tissue to form around these little beads, you don't know how much is going to form. All those people who have the additional scar formation, suddenly they have these massive lumpy. I mean, the number of times I've seen people who've had that stuff put into their lips and they have these hard,
Oh,
awful, lumpy, and they can't feel anything. I mean, it breaks my heart. And to your point about the history of this stuff, right before it was Artifil, it was Articol. I mean, it was based in collagen, and they had the exact same problems. And of course, collagen had allergies associated. So people had this stuff injected, they were having allergic reactions and having these terrible granulomas form. And it was still allowed to get transitioned to Artifil. I mean, that all of that whole history to me, I don't get it. And that I see as a regulatory failure because that absolutely is a product which I see also as being harmful. And I think it should have been taken from the market quite some time ago.
yeah. I think it just shouldn't be out there. We see a fair number of patients who've had it before because there's a place not too far from my office that actively injects a lot of it. And I haven't seen too many. I've only seen one complication myself. It was a young man actually who had some injections of Bellafill for acne scarring. And so implants, as you described it, artificial plastic beads, it can act as a nidus for infection. So bacteria like to grow around it. Okay. It's like a comfortable spot that is away from blood flow. It's a little bit protected. So bacteria grow. And so this guy came to me for treatment of his acne scarring, but he had a chronic, smoldering, red hot focal infection in one cheek. And I'm like, well, how long has that been there? And he's, oh, they tried to treat that, but they only gave him like a week's worth of antibiotics and it wouldn't go away. And I'm like, okay, that needs way bigger guns before we can do anything. And it took, I think, a month or two longer to get rid of that before we could treat him. So yeah, so very much not a fan of Bellafill.
Well, I mean, on the similar vein, other fillers that I'm not a big fan of that have issues. One bioalchemid that was for HIV related lipodystrophy. That was a very common one used for quite some time. And that bioalchemid stuff, I mean, it added lots of large volume and it was able to treat that. I think it initially was FDA and Health Canada approved specifically for HIV facial lipodystrophy, but in
Is that different from PLLA or Sculptra?
it is, yeah. So
Okay.
the bioalchemid it's a
I don't know
gel,
that one, so
but it's
that's
a permanent
probably
one.
not
Yeah,
FDA approved here.
it's polyalkylamide, and
Okay.
I mean it was approved by FDA at one point, but I think it was eventually taken off the market. I'm pretty sure Health Canada took it off the market as well. But
Uh-huh.
rather than having beads, it itself was a permanent gel, and it was really soft. And it stayed soft, but it would migrate. And same issue. I saw a couple of patients where it got infected or contaminated. So, but I mean, but that was an issue with the industry, not necessarily just with med spas, but you know, people want the holy grail, right? They want the injectable lunchtime treatment, and they're looking to have a permanent result from it. So people are willing to buy into this stuff, and that's where the consumer really needs to be aware. You really need someone who knows what they're doing to teach you about the ups and downs. And certainly, if someone's willing to accept certain risks, I understand that. But in a med spa setting, I don't think people would really understand the risk associated with these kinds of permanent fillers.
Yeah, I think permanent fillers are just there's no place for them. I also don't like Radiesse for that reason because you can't dissolve it. So if you have a complication, you can't fix it. I think
Yeah.
one of the biggest things is if you choose some sort of permanent option, you are stuck with the outcome whether you like it or not. And that's a problem because not every outcome is something somebody wants, right? If you go to a new injector and they talk you into Bellafill, you might not like the results and then you're stuck with them. And as you said earlier, right, you can't really get that stuff out. I mean, it's
Yeah.
spread all over, it's all in there. It's yeah.
Yeah. Well,
Um,
I mean, you said something really interesting there about the being able to manage a complication, right? As clinicians, we recognize complications and the importance of that. We treat people knowing what those complications could be, and knowing that we know how to treat those complications. I mean, we look after people knowing that if something goes wrong, we know how to take care of it. But when it comes to products like this, there's no antidote, there's no treatment for it. And certainly people in med spas that are using those sorts of things, applying a treatment to somebody when you don't know how to handle the complication, I think that's not responsible. I think it's up to us to know how to handle our own issues, or at the very least know that they can be handled, and who to seek out and how to get that care for them, rather than just putting stuff into patients and whatever happens. That I think is where things break down, when these kinds of treatments are being done in places where it's not a clinician really doing it.
Yeah, I mean, I think that it is so complicated because you have to tease apart all different levels of incompetence. Okay, so I mean, you can go all the way down to these totally illegal places where they're not medical at all. And they don't know what they're doing at all, and they don't know the anatomy, and they don't even realize they're risking somebody's life or their health. So there's that level of illegal. But then there's this whole sort of middle level of, we're going to do these things. It may even be legal, but we don't know the anatomy that well. We can't treat a complication. We don't have the Hylenex in the fridge to treat it, even if they're using a really good dissolvable filler. It's so there's that sort of in the middle where it's maybe legal, but not wise or ethical. And that's
Well, honestly, I mean, as clinicians, I think we share something, and what we share is a desire to sleep at night. If I can
yeah,
sleep well at night, it means that my patients must be okay. Because if there's something lingering, or I feel like there's something that I didn't do right, or there's a complication, that's like you lose sleep. And so my goal every day
absolutely
is simple. If I
right.
can finish a day and put my head down and I sleep well, that's been a good day.
Yeah. And I do think that if you're, very highly educated and very aware of every possible complication that could go wrong, right? And you are doing every possible thing to prevent those things from happening because like, you don't want to cause anybody any harm. That's us. Like for us to sleep at night, there's no way we could be willy nilly doing things during the day that would potentially cause harm. But for the people who don't know, they have no idea that they're taking those risks, right? So they
Yeah.
can sleep fine.
Yeah. Well, as they say, you don't know what you don't know. And so
Exactly.
people who are doing those kinds of treatments, they don't necessarily recognize the risk they're putting people at.
Right. So my whole purpose here is because as a patient, as a consumer of aesthetics, you also don't know what you don't know. So hopefully what we're doing is we're talking about all these things so that the patients will know and they'll know how to know they're going into a place that's legit and really does care about the outcome and really does care about their health. So, did you have any other stories about ER
Yeah.
complications you wanted to share?
You know what? I got a couple others. One which I saw more than one time was silicone. I mean, still on the sort of topic of injectable fillers, and liquid silicone injected. I've seen liquid silicone injected in people's faces. I've seen it in buttocks. I've seen it in breast. So, I
Yeah.
mean, one of my liquid silicone, I had a woman who was injected in her nose with liquid silicone,
Oh my
and of
god.
course, eventually that eroded through and was dripping out the end of her nose. That was terrible.
Can
And
you explain to everybody why that is of course?
Yeah, absolutely. That's an of course to me. So, liquid silicone, as most people are aware, breast implants, for example, are made of silicone. They're at this point not liquid, they're cohesive gel, and the shell around them is silicone. Silicone is actually a very neutral molecule or element. It can be used for implants, but the problem is it can be used as a solid implant, but not as a liquid. So if you put liquid silicone into somebody, the body reacts to it, and the liquid actually migrates and works its way through tissue. It doesn't stay where it's supposed to. And it's a risk for infection, migration, and terrible inflammation. And it's not a question of if it's going to happen, it's just a question of when. So patients who've had injections sometimes a year or two earlier, and then they don't even recognize why something is going wrong. They just show up in the emergency room with an area that's red hot and sometimes open and starting to drain out. And that's the migration. That's an eventual consequence of liquid silicone pretty much injected any place.
So we used to see a fair amount of free silicone injections in breast back when I lived in the breast cancer world. Mostly that's was done in Asia. We would see patients who had moved to Seattle from Asia. And because generally we don't see that in the US. I mean, do you see people getting locally injected with
No.
silicone in
No,
Canada?
not common, but I have seen local. I have seen local, but there it's the exception, right? It's that person
Yeah.
who reads on the internet or thinks that they can order whatever product online and then offer it in their garage or their basement or whatever, and that patient shows up a few weeks later in the emergency room. So
Yeah.
I would say probably once every year or two through my practice, I would see someone like that in the emerge with. And some of them were longstanding, exactly as you said, Southeast Asia, that had been a common thing done decades ago. But there were definitely some people locally with just indiscriminate injector thinking they had the newest thing.
Yeah, I mean, we would see so free silicone will migrate through your body, it'll go to your lymph nodes, it'll keep traveling if it gets access to your bloodstream or your lymph system. I don't think I ever saw a complication with infection with it, but it definitely made it so that your mammogram would be unreadable because
Yeah.
it's very dense on a mammogram. You can't see through it at all. You can't actually see through it on ultrasound either, so it's a disaster for breast cancer detection. You can actually MRI is effective, but that's very expensive. Interesting. You had
Well, I
another
think
couple stories.
I have one more. I have one more. I saved the most acute thing for last. So as you're aware, filler injections, one of the sort of worst complications you would ever want to see is a vascular issue, a vascular compromise. And so again, for the listeners, the vascular compromise is when you have filler injected somewhere where it obstructs blood vessels. And the worst and most common area for this is center of the face, nose, forehead, between the eyebrows, the glabella. Those are areas where if you inject and it does happen to go into a blood vessel, it can cause skin compromise, and it actually can go, back and cause blindness. I mean, very rarely. I'm happy I've never seen that, but I did see a patient who had injections done around her nose and developed vascular compromise. And within 24 hours, her nose was red, painful, and she contacted back the spa that had performed her treatment, and they stopped answering the phone. They blocked her,
My
and
God.
and she showed up, and I hate to say this, but she showed up in the emergency room, and a colleague of mine had been called. And this colleague, because the hospital didn't have the hyaluronidase enzyme for digesting the hyaluronic acid filler, it was just straight filler, it was just regular stuff. He said, I can't treat the patient because the hospital doesn't have the right materials. And he didn't even, he had the stuff in his office. So
Wow.
yeah, so I really wasn't very impressed with that. So the patient got temporized, sent home, and actually I ended up treating the patient the next day, and that required hyaluronidase. I got the patient to hyperbaric chamber and ended up rescuing them. And in the end, there was no severe tissue loss. It sloughed, but it didn't scar in the end. But acute issue. I mean, it was
Yeah.
undeniable, unquestionable what happened. And obviously they weren't prepared to handle it and didn't know what to do. And then the response is just turn off,
I mean,
block.
that's just so horrible. Yeah, so we have covered what vascular occlusion is before. And it's so good that you're able to save this woman's nose. I mean, so for people at home, if Dr. Goldberg had not been able to do that, she literally would have lost the tip of her nose. I mean, it would have been gone. She would have required your reconstructive services after that.
Yeah,
Um,
a young 20 something, I mean, it broke my heart, honestly, to think somebody could do that to another human and not take responsibility. It was
Yeah.
really,
So always ask if you're going to have filler, always ask that they know how to treat an occlusion, that they have Hylenex in the fridge. I don't have my own hyperbaric oxygen in my place, but I do have my favorite facial plastic surgeon who does in his hospital. So in 10 years, a little over 10 years now, I've seen one occlusion once in my practice, and luckily we have drills every year, right? And we talk and we update our protocols every year, and we were able to treat it, and she was totally fine, no consequences whatsoever. Was recognized right away. Have you do you have a time limit? I mean, I think it should just be treated right away as soon as it's recognized, but have you
yeah.
seen 3 days or less? Or I just think the longer it goes, the more risky
Yeah.
it is that you're
I,
gonna lose.
I, I agree completely. As soon as you identify that there's pain, redness, disproportionate, as soon
Mhm.
as it's a vascular occlusion recognized, then immediate treatment and get them to the chamber. There's no minutes is tissue. I mean, it's not much different from a heart attack. I mean, every moment that the heart
Exactly.
muscle is not getting oxygen, and another bit of it is dying, and the skin is a little bit more resilient, but still same principle. So I agree with you. I think immediate treatment is definitely the right thing.
Right, and it is basically like a heart attack. You're blocking the blood flow to the tissue. I mean, it's not your heart, but you know what happened to the spa? Did anything ever happen there?
No, you know what? In the end, it's hard for me as a clinician to follow up on these things because the patient doesn't always share because they're usually a little bit embarrassed that they chose to have treatment done at a less than reputable place, and they recognize that they took a kind of bargain basement approach to things. And at the same time, a lot of these places aren't registered businesses. There's someone operating out of their home or So yeah, it's really hard to follow up on. And as I mean, the U.S. I think is a very similar regulatory framework as far as Canada is for med spas, and that really is that there is not the clinicians,
Yeah.
nurses, nurse practitioners. They're licensed, and same for us. But med spas, it's not a licensed or regulated industry here. So a lot of places that don't have business registrations, or they could shut down and disappear overnight. So it's really hard as a clinician for me to to follow up on those things and make any difference.
Yeah, one thing that I we have talked a little bit about in the past is when you've been harmed by a place like that, okay, nobody has a license to lose. Nobody has malpractice to cover it. You can't really sue them because they don't have insurance. I mean, they may not even have a business license, right? So if you do become harmed, like there may be not only no treatment, but no consequences for them either, right? There's no recourse that you have. Ah, okay.
Yeah, which
Well,
I mean, that's frustrating for an individual who gets harmed. That's awful. And to think that the harm is irreversible. And the next step is, okay, is there restitution or compensation for the patient? And I mean, that doesn't make things better. But in the end, a lot of these places can't even take care of that. And
right.
then it's like, okay, well, the at the very least, maybe I can make a difference for the next person and make sure this doesn't happen again. And that
Yeah.
you can't do that either.
Right.
And so it's on all levels, a permanent disfigurement or disability, zero restitution, and zero accountability or change for practice. And that's why this industry has really become very inconsistent and potentially dangerous in some ways.
Yeah. I kind of want to point out one other thing about that particular story is that, and I to draw a distinction between getting filler in your nose from filler, say, in your cheeks. In my opinion, nobody should be putting filler in the nose unless you're like an ENT or a facial plastic surgeon, someone who could take the patient to the OR and treat the complication because it's a very delicate vascular supply to the nose. It's really easy to mess it up. Okay, really easy to have this complication. And so there are people who are like on Instagram advertising for a non-surgical rhinoplasty and they're sticking filler in the nose. I just find it so incredibly dangerous. And at least in the Seattle area, I do have an ENT facial plastic surgeon who has a I have a little handheld ultrasound just for emergencies, but she has a very fancy ultrasound and she does all her non-surgical rhinoplasties under ultrasound. And then of course, she's a surgeon, so God forbid she had to, she can treat a complication. So I would say if anybody's interested in anything like that, they should go to a surgeon and not to a random med spa or someone who's, hey, I just learned how to do noses. Oh, because it's so much more dangerous. I mean, you have that risk of vascular occlusion anytime you inject filler, but there are certain places that are so much more dangerous than others. And the nose is like, for me, a big absolutely not.
Yeah.
So anyway,
I agree, and I delegate a lot of injections in my practice to a nurse for lips, cheeks, and the more routine things. But when it comes to anything more than that, and especially for noses, I'm the only one that will do that for patients
you're
in
the
my
guy.
practice, and exactly for what you just said,
Mhm.
exactly for that reason.
Yeah, so go to Dr. Goldberg if you want your nose injected or if you're anywhere near Toronto. I was hoping to shift a little bit to talk about another topic that we briefly touched upon, and that is just what is happening in the industry around the idea of what is natural beauty, and we're straying from that. And so, can you speak to that a little bit? Like, not just what is beauty, but what kind of results? What are you trying to achieve when you're doing a cosmetic procedure on a patient?
Well, that's a great question. Yeah, I think that the right answer to that is looking to enhance somebody's appearance and still keep it within what I would call normal limits. Normal limits for society, normal limits for the individual, their ethnicity. And those normal limits, that's a very gray area. And I think that because of that gray area, that's been dismissed. And all the conversation we've had up until now, I think is a great lead up because the indiscriminate application of treatments is very much the commoditization of all of these things. I think it has driven a change in the standard of beauty, the concept of beauty. And it's a very simple, slippery slope. I mean, when someone has a cosmetic treatment done, within 6 months, their personal image rewires, right? I mean, there's cortical plasticity, your brain actually changes its self image. So, a patient who has an injection done and has their lips enhanced, for example, 6 months later, I mean, their product is starting to dissolve already, but they don't recognize the difference anymore. They just know that the treatment gave them a better look. They were happy. So if some is good, then more must be better, right? And of course, that's the slippery slope for both the patient and for many clinicians. And for those clinicians that are indiscriminate in how they apply their tools, it's a very easy place to go to where you're doing more treatments than you should for somebody. And it's the concept of the premise that I've heard from a lot of different practitioners. If someone comes to me and asks me for a treatment, whether it's non-surgical or surgical, I've heard the same thing from surgeons talking about cosmetic surgery. It's the idea that if someone asks you for something, you should do it. Because if you don't do it, they're going to go down the street and have somebody else do it. And why should someone else do it if they're not as good a surgeon or practitioner as you? So you're going to do it, you're going to save them from a harm. And of course, underneath that, there's this terrible bias of if I do it, I get the money, right? I get that share of that person's wallet. And that bias has really resulted in clinicians over-treating people. And so you look across Hollywood, you look at celebrity magazines, and you look out in society as a whole, and I mean, it's normal now to see patients who have these terribly overdone facial appearances, gigantic cheeks, and these square jawlines that are just ridiculously wide, and no nasolabial folds, and these massive lips. This is becoming not just a sort of exaggeration, it has replaced the vision of beauty. And the advent of filters and social media, I think, has just accelerated that. But we're at a point now where people who are in the formative portions of their lives, teenagers, young 20s, they are seeing images regularly of people with these exaggerated looks, and it's now become normal. They think that's beautiful, and then in their 20s, they're starting to go get these treatments as if they need it. It's become a form of makeup. It's like an everyday, it's time to go for my filler. And I think that the industry has allowed that, and I think it's harmful. And so this is that sort of shift in the concept of what beauty is.
I think that it's more than the industry's allowed it. I think that not you and me, but I mean, the industry has created it. I think with financial incentives, the way they are, most places that you go, the injector is going to be usually a nurse or sometimes a PA or a nurse practitioner, but many of them, most of them are incentivized to inject more. They make more money for the spa and they make more money for themselves. And if they have you for 45 minutes or an hour, if they inject one syringe of filler or 20 units of Botox, right, that's much lower revenue than if they inject 50 units of Botox and 4 syringes of filler. And they can do all of that in an hour and make way more money. And so they're busy doing that. And whether the patient needs filler or Botox or not, and the word need is really not accurate, right? Nobody needs those things, but we like them. I mean, I don't have a problem with that, but you take somebody with a little laxity in their skin, like someone my age, and then you plump their face up filled with filler so the skin is taut. Now they look ridiculous. They have filler volume where they didn't have it before. And really they had a skin issue, not a volume issue. I mean, most of the time we all have a combination of these things, right? It's not a one thing or other, but I would say that like the biggest thing that I see are people who have laxity in their little loose hangy skin and someone's treating that only with injectables. And that's really hard to do, right? And then you end up looking really bizarre.
Yeah, it's true. You can get rid of any wrinkle with enough volume, right? Just inflate someone's face enough, there'll be no wrinkles. And it's really unfortunate because the way that the non-surgical aesthetic industry started in the first place, there was a recognition that people didn't want cosmetic surgery until it was absolutely necessary. And wouldn't it be great if you could stave that off or treat more minor things and at least address them partially and help people feel good about themselves? And that premise morphed. And it morphed because people recognize, well, if I can get these treatments done and look better, then there's no need for cosmetic surgery. I just need more of these treatments. And I think at some point, people need to understand that there's a limitation to non-surgical treatments. And if someone wants results past that, then the necessity is to do something surgical or make a decision that you don't want surgery and you just want to stay in the non-surgical realm, but you can't get a complete correction. And I think that distinction doesn't really get made. And that's where people show up and every month or so, they get a little bit more filler put in, chasing that wrinkle and never, ever really achieving the result that they want, but then not recognizing that shift in their own appearance as their brain kind of rewires each time. And then you get facial cripples. I don't know how else to describe them. I mean, I 3-4 times a year, I have someone come into my practice where they've just been so pumped full of this and that and they'll tell me the story. Well, I went to this doctor and they said I needed to put some here and here. And I went to this other doctor and they dissolved it there and put in this other thing here. And I'm like, what are you? Stop. Like, just here. And with these patients, I have a very clear contract. I said with them, I will rescue them and say, look, for an entire year, you were to do nothing to your face. You're not allowed to get anything injected. I'm going to see you every 3 months. Come back to me. We're going to start digesting stuff away, do a little bit of hyaluronidase, and you are to have nothing done. And if a patient can follow that, and I try to support them through that process, at the end of the year, if they still come to me, then I'll take them on as a patient and talk to them about the non-surgical, the surgical, and try and recover them. But at that point, people come to me often and say, oh, I hear people get addicted to plastic surgery. People get addicted to injectables on a regular basis. And I think we have to put a stop and say, no, this is the end of that. You don't get more of that.
Right. Totally agree. Meanwhile, though, in that year where they're not getting anything, you can do laser resurfacing, you can do RF microneedling, skin tightening. There are a lot of non-surgical things you could do to make your skin look better. And while you're waiting for all that filler to dissolve, whatever's left after you've,
Yeah.
right? Yeah, I think that drift, that self-image drift that you're talking about is really interesting. I think that's really true. People get used to that new look, whatever it is. In the beginning, they might even look in the mirror and go, "Oh my God, what did I do? Whoa, that's big," or "My cheeks are big," or "My lips are big." But then 6 months later, that's the new normal, and a lot of times they're asking for more. Yeah.
Yeah. Well, I'm sure you had the experience. You treat a patient with what you think it's a good, thorough treatment with a nice outcome, and then they'll come back a couple months later and say, I don't see anything. You didn't do anything. What? There's no change. And then you pull up the picture and you show them, and they're like, whoa. Oh my goodness, that was a huge
Yeah.
change. I had no idea. And it's because these people are not malicious. It's simply that they don't recognize, because their brain has managed to rewire that self-image. And so they really don't see that there's a change. It's, I mean, of course, one of the reasons that you and I both keep very good photographic records
Right,
of our
that's why we take
patients.
pictures. It's not so we can do marketing. It's so we can show you we did something. Yeah, I mean, it's the same thing that happens the other way around with aging, right? You look in the mirror, you see the same person every year from the time you're in your 20s to in your 40s, and then sometime you look back through a photo album and you're like, "Oh my God, I look really different now. How did that happen?" Because it's such a slow change, right? You think, "Oh, it happened overnight." I hear that a lot from patients. It happened overnight and really
Yeah, I hear the same thing.
took 10, 20 years to happen. Yeah. So I've heard your approach to these people who have been overstuffed. But if somebody were coming to you de novo, they've never done anything, and let's say they're 50 years old and they're like, you know what, I need to up my game. What's your general approach in your practice?
So I think probably the most important thing, two things, I think. Thing number one, I'm always very open with patients to say, I think you're perfect the way you are. Don't change a thing. If someone is content with how they look and how they feel about themselves, great, good on you. You don't need, as you said it exactly earlier, you don't need, no one needs any of these things, right? This is a
Yeah.
question of enhancing self-image and self-esteem. So that's the first place I start from. If someone comes to me and says, fix me, what do you see? What should I do? My answer to them is the same. You're perfect the way you are. Don't do anything. But you're here for a reason, right? If you've come to me, it's because there's something that you see that doesn't fit or doesn't seem right for you. Tell me. So that's the second part, is asking someone. I solicit from them what their concerns are. And I take that list of items, and hopefully it's not a long one. If someone comes to me with 15 or 20 different things, that's a red flag. But usually it's not. Usually it's just one or two things. I don't like my jowls, right? I'm noticing my brow is down and my eyes look heavy. And so I translate that into a plan, and I offer them non-surgical and surgical approaches to things. But I always put that in context of the bigger picture and a holistic approach to patients. And what I mean by that is I'm very engaged with my patients as far as their diet and their lifestyle, especially when it comes to facial rejuvenation. Anything I do, if someone doesn't have a healthy diet or they're not taking care of their skin, in the end, they're not going to have a good result, or they're going to have relapse and issues after. Anytime I do body contouring or breast surgery for patients, I always get involved in their diet and making sure that they have healthy exercise practices, because it doesn't matter. I can liposuction somebody, but they're going to come back some years later and just have another liposuction done if they're not. And to me, it's a twofold thing. I mean, one is about making sure that someone is healthy so that when they come for surgery, that I know that they're going to have the best outcome, that they'll sail through the anesthetic and they're in good shape. Also, making sure that they're as primed as possible for surgery. If there's a weight loss trajectory sort of coming close to that end point within 10, 20% of their goal, That way I can take out as much skin as possible. And afterwards they go that last little mile. And my surgery is like a transition for them. It's like your tummy tuck gets you over that last little bit. And now you'll lose your last 10 pounds, but you're exercising like a fiend and you love it because you feel so good about yourself. That to me, cosmetic surgery is a tool, but it's a tool in amongst the collection of tools that the patient has to activate themselves with diet and lifestyle. So that's my approach to patient, is solicit from them what they see and what they really want addressed, and see how I can redirect that into here's a plan of what you can get at the end of a needle or at the end of a scalpel, but that's a part of the bigger picture of what's your
Right.
life like? What are you doing to really maintain yourself over time?
Right. I love that approach. That's very similar to my, obviously, I'm not a surgeon, but that's basically everything that I believe in as well. I think that this has been a really great conversation. I was hoping to leave our audience. Did you have any bit of advice before we go on what you would, the number one or number two things you would tell our audience?
Well, people often ask me for my personal secrets, and I have two secrets. One of them is a product, so I'll share the product. But my first secret is my diet. I'm largely plant-based. My wife and I, my wife Stephanie, we became, I won't say vegan because we're plant-based. We're 95 to 98% of our daily caloric intake is plants. We've been that way about 7 years, and I will never go back. It is definitely a huge improvement personally in every dimension. And I've started to recognize in my surgical patients, when I operate on people who are plant-based or vegetarian at least, their tissue is different. It is stronger. The planes dissect more easily. It holds stitches better. It bleeds less. All of it. I recognize you are what you eat, or you are what you absorb if you're a nutritionist. I mean, that's a true statement. It's very true. And I definitely notice a difference in carnivores or omnivores. The tissue is not the same. So that's my first secret. My
Interesting.
second secret, it's a product that the product I really like is something called Glycodin, Glisodin. For a physician, you'd be interested in glycodin.org. And this stuff it's an orally bioavailable form of an antioxidant enzyme called superoxide dismutase. And this superoxide dismutase SOD, this is the only way of getting it into your body orally, and its root cause. I mean, it reduces oxidative stress in every organ system, especially the skin. I've done a few studies on this as far as reducing skin inflammation. So I've been personally taking that for 14 years. I gave it to all my surgical patients to make sure they recover well from surgery. So that's it. Those are my secrets. Eat vegetables and take glycodin.
Well, that's fantastic advice. Cory, thank you so much for talking with me today. It's been so interesting. I really appreciate your being here.
Likewise, Kate, I've really enjoyed the conversation. Thank you so much for your time.
If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's DRKATEDEE.com. Or reach us through the website, medspamayhem.com. And read the book. MedSpa Mayhem is available everywhere books are sold. Thanks for listening. This has been MedSpa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. MedSpa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medSpamayhem.com.